Hi, it's Patrick Hudson from intensivecarehotline.com with another quick tip for families in intensive care. Today's tip is about why intensivecarehotline.com can create a safe space for families in intensive care. So this follows on from last week's video and quick tip where I mentioned why intensive care units can't create a safe space for families in intensive care. So let's start with number one. Well, intensivecarehotline.com as a professional consulting and advocacy service for families in intensive care creates a safe space for families because we don't judge people. Now, as you would know by now, in intensive care you're getting judged left, right and center for your wishes and your preferences for your loved one, whether that'll be around treatment choices, whether that'll be about end-of-life choices, whether that'll be about quality of life choices. You know that you'll be judged, and the intensive care team is always trying to make you feel bad for your wishes and for your preferences. Number two, intensivecarehotline.com as a professional consulting and advocacy service for families in intensive care creates a safe space because we are bringing in transparency. Anybody that's worked with us or talked to us knows that we immediately open up a much bigger platform and horizon for families in intensive care, because the intensive care team is not even telling you 50% of what's going on. As you heard me say before, the biggest challenge for families in intensive care is simply that they don't know what they don't know what to look for, they don't know what questions to ask, and they don't know how to manage doctors and nurses in intensive care, and they don't know their rights. And by us bringing in transparency, by asking the right questions, by helping you with treatment options, that is just opening another horizon for families in intensive care, and it puts the power back into your hands. Number three, we can actually look outside of intensive care and help you with follow-on options once you or your loved one has survived the intensive care stay. What do I mean by that? As you would know by now, the intensive care teams are very quick, wanting to withdraw treatment, wanting to limit treatment, wanting to let people die really, to manage their bed flows, to manage their bed management and manage their finances as well. Whereas here at Intensive Care at Home, we help you to get your loved one out of intensive care alive and then get them to follow on services like intensive care at home or other alternatives, so that you can have your voice heard and that you can manage your loved one beyond the intensive care stay. That's my quick tip for today. Now, if you have a loved one in intensive care, go and check out intensivecarehotline.com and call us on one of the numbers on the top of our website, please, or send me an email to support@intensivecarehotline.com. Subscribe to this channel for new updates for families in intensive care, like this video, and comment down below what you want to see next. This is Patrick Hudson